Keke, I heard about Abby.
Oh, about her new job opportunity.
It's streaming now. Great, we'll get started. Thank you everyone for joining us for Racial Truth and Reconciliation Week, where our mission is to empower the voices and children of marginalized communities and acknowledgement of truth to promote healing, reconciliation, and justice. Today's community chat will highlight the impact of COVID-19 on food insecurity. The participants joining us today highlighting this topic are Holmes from Virginia Association of Housing Counselors, Keke Cody with Commonwealth Catholic Charities, Ramona Beach, a Rock Church member, Jamaal Ellison with Communities and Schools of Petersburg, Leanne Lytle with United Way of Greater Richmond in Petersburg, and Dr. Morgan Maxwell with Petersburg Healthy Options and Partnerships. And I am Chloe Edwards with Voices for Virginia's Children, working on the Campaign for Trauma-Informed Virginia and Racial Truth and Reconciliation Virginia. Thanks everyone for joining us. Let's start off with introductions to each of your organizations. Leanne, who is representing United Way, connected us to a lot of these organizations. Leanne, could you call on each participant of this conversation to introduce themselves?
Sure, I'll do a real quick introduction of myself, real quick. My name is Leanne Lytle. I'm the director of the City and Schools Partnership in Petersburg through United Way of Greater Richmond and Petersburg. My primary role is really as a connector and convener of resources and support networks for the goal of increasing the likelihood of student and family success. I'm also a member of the Southside Trauma-Informed Community Network. I serve on their governance team, and I'm a trauma-informed and resilience trainer. And now let's go over to, I'll just kind of go in order of how everybody is on my screen. Jamaal, you want to go ahead and introduce yourself?
Sure. Good afternoon, everyone. My name is Jamaal Ellison. I'm the Director of Program Operations with Communities and Schools of Petersburg. We are a partner of the school. Our mission is to surround students with a community of support, empowering them to stay in school and to achieve in life. And we accomplish this by having site coordinators that are stationed in each Petersburg City Public School except for Blandford for the time being. So, thank you.
Thank you. Ms. Beach, would you introduce yourself?
My name is Ramona Beach. I am a member of Rock Church of Petersburg, and also I coordinate the meals in the Hopewell and Petersburg area for the homeless.
Thank you. Dr. Maxwell?
Good afternoon, everyone. My name is Dr. Morgan Maxwell. I am the project manager of Petersburg HOPS, which is a CDC-funded grant until 2023 to address healthy food access and active transportation in the city of Petersburg. We're convening various stakeholders, including the Healthy Community Action Team grant, as well as the Center for Public Health Practice and Research to improve the health of those in Petersburg.
Awesome, thank you. Keke, do you want to go ahead and introduce yourself?
Yes, so my name is Keke Cody, and I'm the operations supervisor for the Hopewell Inclement Weather Shelter. When that is in season, off season, I do outreach for those experiencing homelessness in the Hopewell area.
Thank you. Erica?
Yes, hi, I'm Erica Holmes. I'm with Virginia Association of Housing Counselors. I am the board president, and as well as with St. Joseph Villa Housing Resource Center in Petersburg, and with the Crater Area Coalition on Homelessness, the board president there. And the Virginia Association of Housing Counselors is an organization, a nonprofit organization that helps to educate and train those that are in the housing profession on up-to-date laws, best practices, case management services, and so forth. And we are statewide.
Awesome, thank you. Chloe, do you want to?
Let's toss it off. And I introduced myself, but I'm Chloe Edwards with Voices for Virginia's Children. I work with trauma-informed community networks across the state and collaborated with the networks led by people of color to present to you what we have now, Virginia's first ever Racial Truth and Reconciliation Week. So thank you everyone for joining us for this historical moment. And thanks for sharing your background. I'm excited for this conversation. Let's go ahead and jump right in. Erica, how has COVID-19 further exacerbated the need for food insecurity? I know with your background in housing, you've mentioned kind of the intersection of the impact of housing on food insecurity. Could you provide more insight?
Yes, so it's a twofold when you're dealing with a household trying to manage food, utilities, rent, and stay in housing. And what we've seen as housing professionals is a shift in the conversation that we are having with those that are having some type of housing insecurity, be it homeless or on the verge of homeless, where we were focusing a lot on the housing instability piece of making sure rent is paid and so forth, that now we have an added piece that case managers and housing professionals have to incorporate in their discussion with families around food. When school closed in the spring and parents had to be home with their kids and they weren't getting that breakfast and lunch at school that a lot of them depended on, then they had to find a way at home in the midst of everything, as well as now parents relooking at their budget and their income and their expenses, that they now have to provide this additional support, this additional meal that may not have been accounted for before. And it puts a strain. It puts a strain on already hard situation where families are just trying to make ends meet. And then with the added insecurities in the Tri-Cities, specifically in the Petersburg area, with it not being really food places that are accessible via walking. You know, we could get into the whole thing of lack of transportation and so forth, but you know, that all then impacts housing. It all impacts where am I, can I keep my housing? How am I living? How am I paying for food, utilities, and so forth? And then dealing with a pandemic that impacts, you know, the loss of income, the loss of kids being in school. So yeah, we've just had to kind of switch our gears and make sure that we are providing additional resources and connecting with people like Jamaal with Community and Schools and Leanne and so forth, to make sure that all families are having a meal, and the 3 meals a day that they otherwise would not be able to access.
Mm-hmm. Leanne, what community level interventions have you seen in response to this issue with your work with United Way, and what role has United Way played in that response?
Sure. So just to kind of start by saying this, since United Way is not necessarily a direct service organization in the traditional sense, a lot of the boots on the ground and effective work around this that I've seen come from these partners on this call and other organizations who have pivoted and shifted their work to really begin to address basic needs in a way that they hadn't done before. One of those being food insecurity. So really, these are the things that I've seen that have been effective, and you'll hear more about what each of them do as we go through the call. United Way's response has really been on a few different levels. First, we've continued to offer the same community-based support programs that we always have. So first and foremost, that includes our partnership to support Virginia's 211, which provides services or access to services statewide. Whenever an individual calls 211 or goes to the website, they can receive confidential referrals to government, nonprofit, community-based agencies, or businesses who provide health and human services across Virginia and in their communities. One thing we know and we've seen from 211 data since the beginning of COVID-19 is that there's been a higher rate across the state of calls for emergency food support. And then once the ban on evictions was lifted on July 1st, we saw a stark increase in the requests for emergency housing support. So we know that these are, to kind of echo what Erica's already said, those are issues that are tied together and that we're seeing across the state. United Way also supports the Emergency Food and Shelter Program for our service area. So this program helps to fund nonprofits and public agencies who are providing food services, shelter, rent, mortgage, and utility assistance to their residents. In Petersburg, which is where I do most of my work and the folks on this call do most of their work, those associated agencies are Commonwealth Catholic Charities, the Salvation Army, and Downtown Churches United. If anybody who's listening to this is interested, they can find other associated EFSP agencies within the service areas at yourunitedway.org. Let's see, one other thing is the Energy Share program that we administer for Dominion. This is a crisis program that leverages support of Dominion along with over 4,500 individual donors annually to help pay energy bills for any type of heating and cooling source. So people can access that. And again, people can find information on that mostly through Dominion's website. And then we also play a role as funders. So we have several funded agencies that we support, and we've worked with them to help them pivot or see how we can support them even in the funding that they've received in this last year. But then also as a funder, United Way has partnered with other local funders to support the Central Virginia COVID-19 Response Fund. And that's a crisis response fund that's focused on the impact of the coronavirus. Collectively, like you've heard, I mean, we knew the demand for services like food, shelter, childcare would just heighten during the crisis. And some of the programs we fund, as including some of the ones you see here, are in the services they already provide are in high demand. And we knew that with the crisis, and as the crisis continues and the economic impact of the crisis continues, not only are those services going to be in demand, but then also an additional and increased need for basic needs is going to increase. And then I think finally, I would just say the thing that we know that underscores all of this to the point of the conversations around Racial Truth and Reconciliation Week is that we know that our region's history of systemic racism has really accelerated and perpetuated some of the generational poverty that we see, the lack of access to quality education, lack of access to healthy foods, food deserts, increased exposure to environmental hazards and health concerns. And just in neighborhoods across our service area, it's often our people of color and Black and brown neighborhoods and communities who are the most vulnerable to the circumstances the pandemic has created. And at United Way, we want to be able to continue serving well in the way that we've served, but we also want to consider how to address these deeper equity issues inherent in the work that we do that I just described. So those are some of the things. I know it's a lot. It's like a laundry list of services, but those are some of the things that we've done and that we support.
Well said. There are a lot of themes there. I want to loop it back around to Erica. Leanne, what you described is kind of the intersectionality of food insecurity and housing. Erica, with the possibly the eviction moratoriums being uplifted with the HEROES Act not coming into play in the time we thought it would, how do you think that specifically, in what ways could that concretely impact some of the populations that you serve?
Just like Leanne was discussing, and specifically in the Tri-Cities area, which is majority minorities, are being, impacted with the evictions. Petersburg itself was already a prime area that evictions were high pre-COVID. This was happening pre-COVID. We were already discussing on a state level and with Central Virginia Legal Aid Society about, come July 1, we need to implement this eviction prevention program. But it didn't take an effect that we were going to be impacted by COVID, which left people unemployed, trying to figure out how they're going to sustain. And a lot are reaching out to these other organizations for food so that they can have money to pay their rent and to stay in their housing. And we're looking, just to give you guys a couple of numbers that I just recently got from Central Virginia Legal Aid, where it is about, as of July 26, it was 167 households pending court, just in Petersburg. And Hopewell on July 26 was 103 families, and Prince George, it was 55. So, these are families that are going in to court for eviction. Once they go to court, they're looking at a 10-day turnaround to try to come up with funds. So they are constantly, in crisis mode. This impacts not only them, but the children that are in the household, trying to figure out, what's going to happen next with my family. And we are seeing that this problem, due to COVID-19, is going to get worse. That the courts have been able to extend some landlords that still fall under the CARES Act for the next 30 days. So we still do have some communities and landlords that cannot file in court yet. But come the end of August, that is all going away and they will be filing. So those numbers that I just shared with you guys, we will see those double in the next 30 days, come September and October, when kids are returning back to school. And I just want to say, not to take up too much of everybody else's time, that, specifically for our, Black and Brown community, this is something that we were already in a day-to-day trying to figure out how I'm paying my rent mode for the majority of the households, and to then have the pandemic hit and add this extra stress level, and the extra, we're really seeing then the lack of food resources, the lack of healthcare resources, and all that stuff. It was there to begin with, and COVID just kind of brought it to the forefront, because it's not only affecting the Black and Brown community, it's affecting the white community, and so because it is impacting those that are not of color, then it's all these, things that are being put in place, which is great. And we all are, are thankful for that, but it took this to happen. you know, to get that funding and to bring to light the fact that we don't have enough grocery stores besides the corner store, convenience store, or market for our families to get fresh fruit and vegetables and things that are affordable. That's my on my soapbox.
Yes, it could be a real dire situation for families. And to everyone listening in on Facebook, I just want you to know, feel free to ask questions. We're paying attention to the comments on the Facebook page. So if you have any questions, feel free to ask us. Thank you. Keke, Commonwealth Catholic Charities works with many already existing programs. How and why has the pandemic impacted the way in which these programs operate? Why does there seem to be a gap?
So I'll backtrack just a little bit. So in my position, I work with folks who are what you consider to be literally homeless. So those are folks who are either in emergency shelters or sleeping in places not fit for habitation, like their cars or in tents, things of that nature, or who may be in a hotel being paid for by an agency. So we typically consider this population to already be one of the most vulnerable subsets when it comes to connecting their resources on their own. Whether it is simply because they don't have a phone, or they don't have anywhere to charge their phone, or they don't have transportation to get to these places where they may be able to connect the services. So with that being said, the impact that has been had further on this population and the service they can connect to, it's just been made more difficult. Whether it's food resources or Social Security services resources or employment resources, just whatever. So for example, focusing on food resources, if folks aren't already receiving SNAP benefits, formerly known as food stamps, then they have to be able to complete an application. If the library is closed, they don't have a phone or someone with internet where they can do this at someone's house or anywhere else, how is that going to occur? So then folks like me come in and they can use my phone to complete the application, or I can use my hotspot on my laptop to do that for them to get them connected. And then you also have more questions like, well, what about the mail I'm going to receive that has my appointment time and date on it? So there's all these different pieces that are already being made difficult for this population. The pandemic is just exacerbating that issue. How services are even operating is making it even more difficult. For example, when you have places who the phone calls have just skyrocketed so high where you can't get in, so there's not someone necessarily answering the phone right then. People aren't working at their offices no more, they're working from home, they're checking voicemails, they're calling folks back. So that makes it more difficult for a client to be able to get in contact with the service providers so they can help with whatever issues that they're having, and that may vary what the issue might be, whether it's food or Medicaid or whatever. So even how I'm interacting with these agencies is looking different, let alone for how a client is experiencing these services. That's something that I'm seeing. It's just all over more difficult. Even connect with places, receive services, and the time frames have changed also. Just the pure access to those resources have been made more difficult.
Right. So many of these families, while some may be on unemployment right now, many are frontline workers and working class families. Leanne, United Ways of Virginia recently released the Ellison, Virginia, a financial hardship study, which highlights the persistent level of hardship that many families across Virginia experience. Could you share more on how the ALICE population, what that stands for, has been impacted by the pandemic? What circumstances did these families experience prior to the pandemic? How has it worsened? And tell everyone what ALICE means. Who is ALICE?
Yeah, that's a great question. And that's the first thing that I wanted to do. So ALICE is an acronym that stands for Asset Limited, Income Constrained, Employed. So these are folks who are in hourly jobs, they're in service industry employment, possibly government work, possibly health workers. It's your cashier at the grocery store. It could be the aide in your child's classroom, the nursing assistant at your doctor's office, could be the server who delivered your meal to curbside pickup last weekend. And during COVID-19, like you said, Chloe, they represent a section of the workforce that's been at higher risk of either layoff and job loss or increased risk exposure to the virus because of their role in the health field. Like you said, these individuals, they don't fall under the federal poverty level, but they are unable to keep up with the increased cost of living. They probably don't have a savings. And so when it comes to a financial hardship that happens with a job loss or a medical hardship, they're not going to be able to sustain or make ends meet once that happens. So you're going to start to see an increase in the ALICE population, an increase in people who have been working or even are currently working who can't make ends meet. So one of the things that's important to know, I think when we think about this in light of COVID-19, is that when we have to think about what happens when a family who doesn't have a savings or a safety net, that's another piece, especially when you think about generational wealth. You know, folks who benefit from a generation ahead of them who's had some wealth, maybe they have a safety net that can hold them and kind of sustain them during this time in their family. But if you have an individual or a family who doesn't have that generational wealth in their family, then they really don't have a place to go to for a support system like that, a financial support system. So when they encounter a financial issue like this, or job loss or medical problem, you begin to have an exacerbation of the issue of not having access to basic needs, not being able to afford housing, not being able to buy food or healthy foods, and just that need increases. Between, just to say a couple things statewide and kind of some trends that we see in ALICE, between 2007 and 2018. So the most recent report is the numbers from 2018. But between those years, the number of individuals and families living under the ALICE threshold increased by 9% across Virginia. And the report makes it clear it's not because there was actually an economic upturn in Virginia. We were doing pretty well, but because the cost of living has expanded, but the pay rate and access to higher paid jobs has not increased, that population keeps expanding and growing. I would say the other thing to think about, particularly, I think Erica really already said this, the trends around ALICE, we know, that this population is more likely to be non-white, more likely to be heading single parent households, and they're more likely to be young or part of our senior population. So either under 25 or over 65. Those are our most vulnerable populations. And then insofar as their inability to make ends meet impacts their housing and food access, I think what we're going to continue to see, and what we've already seen, and what we've already heard even on this call, is that there's increased food insecurity. There's going to be an increase in inadequate health outcomes. We'll see more developmental delays in children. We'll see increased social emotional needs in schools. As communities, we'll see higher healthcare costs. We'll see lower productivity in our workforce. And we'll keep increasing our spending on these emergency services to address the needs of the population, which isn't a great thing and doesn't necessarily lead to a thriving community when we have to put all of our resources into crisis management. So.
Right, and as Virginia prepares for a special session, which will begin August 18th, we do have the opportunity to hopefully use our experiences as professionals, connect with those who are experiencing these situations, to advocate at the General Assembly, or probably virtually, we're not sure yet, to intervene in some of these situations. Ramona, we know that there is a gap in community resources and state responses to food insecurity, such as we've heard of the Intervention Pandemic EBT, SNAP, WIC. How has the faith community stepped up to respond to the needs of the community? What role does the church play? If she's still on this. Is she on mute? please.
Ramona, you're on mute. You're back on mute.
It keeps, we good?
There we go. We got it.
Okay, thank you. Well, before COVID-19, we had a group in the Hopewell area that supplied. It was a group of network of churches in the Hopewell area that supplied hot meals every day to our homeless. After COVID-19 hit, we had to shift gears, and what we're doing now, the same group, same network, taking up donations, and we're supplying groceries to those that have been put up in hotels, the homeless that have been put up in hotels. Yeah, that's been put up in hotels, and that's about it.
Mm-hmm. Have you had members reach out? Are you seeing any trends in the needs of members outside of food and housing as well?
Have I seen any trends? Yes.
What kind of trends have members been reaching out to the church for?
They've been reaching, well, mostly for groceries and toiletries and stuff like that, items like that, emergency and essential needs.
I've got you. And these are not items that are covered by what you would buy at a grocery store, of course, with EBT. So Dr. Maxwell, there are some programs that you are working with. Could you share more about what you are doing at the ground level to increase access to food? You have several great examples.
Absolutely. So Petersburg HOPS was originally funded by the CDC, the Centers for Disease Control and Prevention, in order to combat the obesity crisis in Petersburg. All of the cities in Virginia, Petersburg was the only city to qualify for the grant to receive funding to address the need for healthy food and also the need for more options for healthy, active transportation. So much of what we are doing now is centered around food insecurity, especially as it was said earlier, the families and students in Petersburg relied so heavily upon the schools for food, and once they were closed, we had to pivot. So our farmer school activities were no longer as pressing as the need to connect families to food resources. And so luckily, the connections that we had made prior to address obesity were actually beneficial in shifting gears to distribute food. So one of the things that we've been able to do is partner with the Ag Center as well as River Street Market, as well as Virginia Cooperative Extension, and also several organizations in the Petersburg area, faith-based organizations, specifically KCEC, which is Kingdom Covenant Empowerment Center, to provide spaces for folks to either connect with food or find some food resources. So one of the things that we've done is partnered with Underground Kitchen with their meals. And so we've been receiving at least 400 meals a week to distribute to the community. So we took advantage of some of the sites that Petersburg Public Schools set for the families in Petersburg. So we distributed food there. We are also distributing food at the Hope Center, which is a food pantry in Petersburg. We're also distributing those prepared meals at KCEC. Again, the church here, it's adjacent to a community that desperately needs food resources. And what we're really proud of is the fact that we're launching a market called Pop Market, which stands for Petersburg Offers Produce. And for many of the families here, accessing healthy produce is a problem. There are very few locations in Petersburg where you can access fresh fruits and vegetables. River Street Market is one of those locations, but they are only available on Saturdays. And on top of that, they are located in downtown Petersburg. And as it was also said on the call, transportation is an issue for many families in Petersburg. So part of the market's function is to bring fresh food into the community. So many of the communities that we're trying to touch only have access to corner stores, or they're significantly distant from the Walmart and the Food Line, which are the only two grocery stores in Petersburg. So we're not only access to healthy food, but on top of that, we are also spreading awareness and use of the Virginia Fresh Match program, which many folks are not aware of. It's an opportunity for folks who receive SNAP benefits to maximize their dollars. So River Street Market is in a position where they will match any dollar spent on vegetables and fruits. So if you spend $10 on fruits and vegetables, they will match it, and you will receive $20 in fruits and vegetables. So what we've done is we've taken that amazing program and we worked with farmers in the local area to create produce boxes. And so right now, because of the pandemic, while our goal is to open up a market where people can freely shop, right now, because we want to adhere to social distancing, we want to limit the contact that folks have, we have created these boxes so that folks can come in, use their SNAP dollars quickly, and get a fantastic box that's filled with fruits and vegetables, as well as some other baked goods, some granola, some fresh eggs. And we've also been able to partner with Virginia State University, Randolph Farms, to receive some produce as well to connect the dots for folks so that they can see that you can eat healthy and it's delicious, and that there are other places in the area that provide those options. So we are actually having a pop market this Friday at Kingdom Covenant Empowerment Center, which is located at 1420 Farmer Street, Petersburg, Virginia. And that is available from 11 a.m. until 1 p.m. And again, we have fantastic boxes of produce that are available, retailed at $20. So if you have an interest in them, regardless if you receive SNAP or EBT, they're $20 beautiful boxes of produce. But for those that do receive SNAP EBT, we also have those boxes available for $10. So it's automatically half off given the Virginia Fresh Match program. So we're spreading the word. We hope that the community comes out and takes advantage of that opportunity. What we're hoping is that we can expand the pop market to other locations in Petersburg. So this is a pilot program. So we're seeing how it's working. We're surveying the community and asking where else should we be? What other vegetables and fruits would you like? Where did you hear about us? We're using all of this information to try to better connect families to food resources. And just to connect to the other panel members, we're also trying to address the fact that many families do live in hotels in Petersburg. And so we recently had Best Inn agree to receive some of those underground kitchen soups. And we are going to connect more to other hotels in the area to see if there's interest from the families to receive soup. So we have rented refrigerated trucks. So we've been taking the soups all over. We've also partnered with Tabernacle Church, Metro Baptist Church, as well as Metro Gardens, which is an adult group home. So we've been able to connect to many places, either with our free food through Underground Kitchen and other donations that have come through Randolph Farms. We also donated Sabra hummus at the beginning of this summer. And then we also are providing an opportunity for folks to maximize their SNAP dollars through the pop market and access healthy food, specifically fruits and vegetables.
Now tell everyone, for those who may not be, who may live in the suburbs or a more rural area, why are these resources so important to the residents that you serve?
Well, one, accessing healthy fruits and vegetables is great for your health. And as I said originally, we are receiving funds from the CDC to address the high obesity rate. So by providing options for folks to access healthy food, we're increasing their ability to engage in healthy behaviors, specifically consumption of healthy food. Partnering with VCE, I'm sorry, I'm remiss to, I would be remiss if I didn't mention the fact that in those boxes, we also include recipes from Virginia Cooperative Extension that can help folks understand how to better use the produce that they are receiving, especially if they're completely unfamiliar with it. But it's also important because maximizing the dollars during this time, as everyone has mentioned, is just so critical. The Petersburg Public Schools, they have shifted gears a bit. I know they were distributing food, but many of these places are either limiting what they're providing, but in the case for the Hope Center, for example, we have sent food distribution assistance for some months now to these locations. And prior to the pandemic, on Tuesdays, they would probably give out about 19 units. And just recently, last week, they had an uptake to 52 units. And so as it was mentioned, there's just an increased need for folks to get access to food now, especially given the loss of jobs, the loss of homes. And what I'm really proud of is that we're working to, because part of the issue is that one, folks can access the Hope Center by either walking there, but how do you get back home with a box that comes of food? That is a problem that we're trying to solve. So we're working right now. We just got word from the director of Petersburg Area Transit to actually distribute food in the transit center as well, so that folks can kind of bypass the need to walk and carry their belongings far distances. I hope that answers your question.
Yes, and we have a question. Well, could you what is the name of the church and the time of the event?
Sure, it's Kingdom Covenant Empowerment Center, and it's located at 1420 Farmers Street. And the pop market is going to occur every first and third Friday, and it happens from 11 a.m. until 1 p.m.
Chloe,
Go ahead.
I was just gonna say, would it be okay if I kind of added on to or just addressing what you had asked?
Go right ahead. And could you explain it to everyone who may not know, what is a food desert? What is a food desert, and why is that so known in this particular area?
Mm-hmm. So that's kind of what I wanted to talk about, because if you're living in the suburbs, you don't think about this. Probably within 5 miles of your house, you have at least one grocery store, if not like 4 quality grocery stores where you can go and you can get access, no problem, to healthy fruits and vegetables, fair priced, healthy foods. But when we look in areas, and I know Dr. Maxwell could speak to this for sure about the geography of food deserts, but if we look even in our area, particularly we can look in Richmond and we can look in Petersburg, what a food desert is a place that doesn't have access to those foods. There aren't grocery stores. And so you can look at that, and a food desert could be, a smaller radius, because if you consider issues of transportation, so if you have a whole community that lacks access to transportation, they might have a grocery store and access to healthy fruits and vegetables 2 or 3 miles away, but that's not realistic in their day-to-day life for being able to go and get their groceries. So they're going to go to the corner store or to the Dollar General or wherever is close by to purchase whatever food is available. So the work that Dr. Maxwell is doing is so important in this area, because Petersburg is considered a food desert. And so the work that PHOPS is doing is really striving to provide access by going into the community. I know probably in the background of their thinking is always, how do we create more access to healthy foods, either with grocery stores or things like that. But I think that's really the main issue is that access to food. But hopefully that answers the question a little bit too.
Right. Now let's talk about children's access to food. When the pandemic first started, many schools were doing meal delivery programs. Pandemic EBT came out to help respond. Some schools had situations where you could come, pick up your meal, leave, etc. There were food waivers. Jamaal, with schools out now, how are children getting what they need? What are possible solutions to ensure children get access to food, whether they are virtually learning or in person? We know some schools are still making decisions on whether the school will reopen, whether it would be a hybrid program, et cetera. But in what ways can schools respond to the needs of children? And in what ways have they responded?
Mm-hmm. Well, there have been quite a few entities and organizations who have really stepped up to the plate to really step up to address this need. I'll speak in regards to CIS. We've had to.
CIS stand for, sorry.
CIS is Communities and Schools, and we're Communities and Schools of Petersburg. And, we've really had to shift gears just like everybody else has. And, typically we operate with site coordinators based in each Petersburg City Public School, aside from Blandford. So each site coordinator works in case management. So the role of that, and also we try to service at least 10% of, the students' population of each school. So the role of that coordinator is to provide wraparound supports to help remove any barriers that may impede a student from eventually graduating and achieving in life. So kind of at the onset of the pandemic, our site coordinators reached out to all of our case managed families to check in and also to conduct a needs assessment, to see what needs there are. We came back, there were many pointed needs that were addressed, with each family, but we came back with, a list of many common needs that were amongst the families. So what we did was we took that list, and it was mainly, of course, food. There were also hygiene products and cleaning supplies as well. So as a result, we started reaching out to partners and were able to secure funding as well to acquire these items. We also were able to do a grocery giveaway, which was conducted with Publix in Colonial Heights and Rosie's Gaming Emporium. It was also spearheaded kind of also by our school board chair, Mr. Kenneth Pritchard. But we were able to do that. And then after that, we started coming out each week to distribute food and those cleaning and hygiene supplies at Mount Olivet Baptist Church. And we're out there every Wednesday from 10 a.m. to 12 p.m. And we also still have our site coordinators reaching out to families to do these check-ins periodically, because the needs are still growing and the needs are changing for our families. So we're just trying to keep in contact to make sure that we're doing all that we can to meet those needs. As far as looking forward into how we can continue, we will definitely continue what we're doing as far as providing basic needs. And we have a lot of partners like Feed More and the Chesterfield Food Bank that were already doing things within the schools during the school year. So we are looking to expand on what we were doing because, as many have mentioned, that the need has been exacerbated now. So we're looking to expand on things that we're already doing, also looking to bring in more partners and, more opportunities to supply, these hunger needs. The other piece is, if anybody knows me, especially those that are on my team, I love to use the statement, we're building the plane in the air. This is uncharted territory for PCPS, for us, even for our partners. So logistically, there's a lot that has to be figured out. How will we get the food to Petersburg? How will we disperse the food? How will we get, where is it going to happen and all of these things, what are the times and things of that nature. So, those are things that we're currently working out, but at the same time that we're trying to meet this immediate need, we're also still sitting at the table having this discussion that we've been having. Again, I think it was mentioned earlier that, of course, it's well known that this was an issue before COVID. Mm-hmm. It's been, of course, it's an issue now, a bigger issue, and it's even after the pandemic is over, it's still going to be a huge issue. So right now we're serving the immediate needs, which is kind of like a Band-Aid, but we're also still having these conversations with various organizations and entities about how to really combat this issue of hunger long term. Mm-hmm. So there are a lot of things that are at the table. I apologize that I don't have more concrete answers for right now, as opposed to how we're going to combat it. But, there's a lot of things logistically that we are putting in place, but the main thing is that we do have the willing partners and the willing pieces in place. So now it's just figuring out how to best, utilize those services and really serve our families. And I will put out as well, if anybody is looking for a list of, supports, food supports for our families and our students, there's also a list that is on the Petersburg City Public Schools website. Mm-hmm. And that is, and help me out, Leanne, if I struggle on this, it's petersburg.k12.va.us. I'll repeat that. petersburg.k12.va.us. And as soon as you get to that homepage, if you scroll down a little bit, there's a little picture there. It's like a green and red picture that says, food options or something like that for our families. So.
Okay. And we had a question, while I still have you, Jamaal, were all the students in Petersburg provided laptops or Chromebooks with data?
Now that is probably more of a PCPS question than a CIS, than the communities and schools questions. But I will tell you this, those are, I believe there's a good plan. And if you want to reach out to the school board office, there would definitely be somebody there who would be able to answer that.
Great example. So everyone, can reach out to the school board if you have any questions. But also I encourage people to build relationships with their school board as well. I'm talking to my computer like there's a person there. But I do encourage everyone to build relationships with their school board as well to advocate for themselves, their families, and their children. And then there's another question for Dr. Maxwell. Some of the resources that you mentioned, are those Petersburg specific, or what areas do they cover?
Yes, ma'am. They are Petersburg specific. As I said, we received funding from the CDC to address obesity specifically within Petersburg. And so that's why we are focusing our efforts there. But just piggybacking on the conversation that we were having earlier about why it's needed, there are so many census tracts that demonstrate that there's an overlap of racial equity issues and food access issues. So the places that are considered to be impoverished are also Black, but also have a lack of food resources. And so that's the reason why we're centering our work in that area. We understand that there are other areas that can definitely use the support, but Petersburg in particular has an acute need for the work that we're doing.
Mm-hmm. And we still have a good amount of time. Huh?
I was just going to add too that for other locations and other resources for food resources, that people can go to the Crater Area Coalition on Homelessness website. That area, we covered the whole Crater region, which includes Petersburg, Hopewell, our rural places like Surrey and Sussex, and all those places also are food deserts and poverty stricken and all of that. And so they're all having this same impact from COVID with the lack of community resources. And it's places that are cities in particularly that can get the state and federal funding or have the backs of city officials, but then you have localities such as our rural areas like Surrey and Sussex and smaller entities that are being affected too, that do not have those types of funding resources. So I just wanted to share that and highlight that, like it's still something that we're trying to figure out, and we're living in this constant crisis mode, like Leanne mentioned, of trying to just provide what we can as we can and as we get the resources. So as resources come available and are shared in the whole Tri-Cities, they can find that on the Crater Area Coalition on Homelessness website, which is cachcoc.org. So I like to share that because we try to keep all of our partners' information updated on that site.
And then Chloe, just to add to that, going back to what I said, people, if they're outside of the Crater region or even outside of Central Virginia, they can always call 211 to get a referral to supports in their area. And then if they are in our region and in our locality, so like Charles City, I'm looking at our EFSP website or EFSP page that lists our partners that do the Emergency Food and Shelter Program. So that would be, we've got folks here from Charles City County, Colonial Heights, Henrico County, Petersburg City, and Richmond City. So that would be a resource on yourunitedway.org/EFSP-2020.
Okay. And Erica, could you explain to everyone what CASH does and what CASH stands for?
Oh, yeah, sure. CASH is the Crater Area Coalition on Homelessness, and we are a part of the Balance of State Continuum of Care, which is basically the services, the homeless services that are provided to a community. Each community, HUD has gave guidelines and policies and procedures around having a coordinated entry process in order to identify those that are homeless in your community, and any that, and they go through and get an assessment done to be connected to a housing resource. Some of that is state and federally funded, but some of that connection is really just using the family's own internal resources and working with other partners to find them housing. And so CASH is membership based, and it has all Commonwealth Catholic Charities is a part of it, United Way, Communities in Schools, and we're all getting together and putting our resources together to address homelessness and address, and with that comes, our kids able to attend school. If is it a high absentee rate because they don't have a home, it plays into the food insecurities and, all of that wrapped around having housing. And so, CASH is an open membership to anyone to join and come together that wants to talk about how we can end homelessness in the Tri-Cities area. And I saw a question pop up in the chat. Yes, CASH is CACHCOC.org.
Thank you. Could everyone, because we have time, kind of explain how COVID-19 and the trauma of Black Lives Matter, not necessarily Black Lives Matter, but police brutality, which has caused Black Lives Matter momentum to resurface, has impacted or changed the way in which you do your work to meet the needs of the community?
I'll start. I would say in all aspects of the different organizations I work with and work for, that what has happened with Black Lives Matter movements and the police brutality is things that have been happening in our communities, and that now is being talked about and being addressed, and it's hard conversations, It's emotional conversations, but it is something that needs to be talked about in organizations. And I think it has allowed us that sometimes in our organization, especially me as a Black female in a supervisory position, not always comfortable to speak out about what changes need to happen within your organization. And I think with it being talked about like it is now with the Black Lives Matter movement and all the conversation on the news, it does allow you to open that and look at your own organization and say, what do we have in place to address racial inequities in the organization itself, and not being afraid that it would be some type of backlash or seen as that loud Black woman that's trying to speak up for what is right. But it lays that foundation for us to have this conversation that we've been wanting to have within our organizations and within our communities, that we were, really afraid to be able to talk about, because we all still have jobs to do and families to support. And I think it's great. It's a hard conversation to have, but I do see that the organizations that I work with and for are now talking about it and incorporating trainings that should have already really been, everyone should have had, with diversity and implicit bias. That's like the big term that everybody's talking about and doing training on like it's new, and it's not new. It's been around, and you've been doing it and acting on those implicit biases for years, but now we can talk about it.
Yes, I think in many ways, the pandemic and the wide media coverage that Black Lives Matter has received, and a lot of issues such as the police brutality, George Floyd, et cetera. These are not things that are new. Police brutality has happened. The murder of Black and brown people, they've happened already. But in many ways, this attention to it, because the world is paused with COVID-19, people are more idle, has really created some opportunities in many ways to finally address these issues of inequities that previously we may have not had space for. But I encourage others to join in. And I've also posted a comment on the Facebook, our Facebook participants. How has COVID-19 impacted your work or your everyday experiences? And what influenced you to participate in RTRW? Feel free to comment, and we may read some for folks who comment.
Chloe, one of the exciting things that I've seen, I think what you're talking about to me feels like a tipping point.
Mm-hmm.
And I'm glad to see it, because I think what was happening before is that something would happen, we take a stance, we make a statement, but now we stayed idle, like you said, for so long that now the people who have made statements in the past are now taking it a step forward and saying, okay, maybe we need to shift some things. And it's been exciting for me to watch internally at United Way, because United Way is over 100-year-old organization. It is the system, right? It is a system that has been set up. And internally, the United Way worldwide has said and been very transparent to say, we know we're part of that system, and we're ready to start intentionally making some shifts. And so just July 28th, United Way Worldwide's board voted to adopt some significant equity principles for their membership. And so, that's all very new, but it's all systematic, and it's a new approach for United Way. So, I don't think our work necessarily has shifted yet, but so many of us in the community side of things see it, and we understand it. And so we're excited to just kind of walk that path of helping to make that change and think critically about what that can look like. So I'm just excited to be part of a conversation like that in an organization like United Way.
And I'll join in too. I think with communities and schools kind of being already advocates for students, we were kind of mired already in the work of social justice and things of that nature. And our affiliate, you know, and just to kind of give a little background, Communities and Schools is a national organization. So we're an affiliate for Petersburg, Virginia. We, a little bit before the unfortunate death of Mr. Floyd, we we signed up to be part of this cohort for DEI. And, you know, with everything that has happened, you know, and to everybody's point, it's really opened up the door for some excellent conversation, some excellent self-reflection. And, you know, just so many things, you know, have been open, and I'm just happy to see the doors just being pushed open on so many things. I remember when I first came to Petersburg, working in at Peabody Middle School. I remember there was talk among some community members that was saying, man, we got to change the names of some of these schools. We got Jeb Stewart, we got Robert E. Lee, we got to change the names of some of these schools. And eventually, you know, they happened before all of this. However, I'm just so happy to see now that so many people, and as unfortunate as the events may have been that got us to this point, but so many people are waking up and being aware now as to some of these things that are happening for our in our communities. But also I think the other part of the question was, how has COVID-19 affected the work as well? I'll tell you, for one, it's definitely made me focus on worst case scenario planning, you know, and really, so it's like, you know, our whole model, CIS operates on a model. It's like our whole model has been flipped upside down, you know, and it's like, all right, so we have to figure out now to really have something in place in case, you know, maybe, God forbid, you know, half the staff leave or you know, something happens. I mean, so it really taught me a lot about preparation and really, you know, just really making sure we have some worst case scenario planning going on to make sure, because I mean, we all got caught off guard. We all got caught off guard when everything came, you know, as far as schools, you know, we were like, oh my God, you know, people are going to be hungry. People are going to be getting evicted. What do we do? So now it's really just taught me a valuable lesson to really have things, you know, try to get things in order as much as possible, you know, just in case disaster strikes.
Anyone else like to interject?
I was just going to add that in my work, I think the Black Lives Matter movement and the shift in narrative has in some ways lifted the stigma that's associated with homelessness and food insecurity, because before folks would pretty much put the blame on the individual and say, hey, you need to, you know, pick yourself up by your bootstraps and this is your fault. And whereas the issues that are being revealed now are obviously that these are a result of external factors and larger systemic issues, a lack of infrastructure that people on the ground don't have control over. And they're just trying to make do with what has been given to them. And in many instances, it's very, very little. And so in my work, I'd like to think that more folks are open to donating and to support homelessness and to support food insecurity in a way that they didn't before, because there's now an awareness that it isn't just the fault of the individual. It's a fault of a system that has failed families time and time again. And if you do your research and go back historically, this is generational. And when you see that certain families were denied housing opportunities and certain families were denied loans and certain families were denied access to food and voting, all of these things have culminated into what we are experiencing now. And unfortunately, it took the murdering of Black and brown bodies for folks to become aware of that. And so for me, I'd like to think that more folks are going to recognize that we have to help as a collective, because it's not just their problem, it's our problem.
Yeah. Well said, well said.
Yes, I completely agree. And it's not their problem, it's our problem. I think we need to start adopting as a Commonwealth, as a nation, exactly what that means. Because many people, when we say Black Lives Matter, I mean, of course, we're not saying all lives don't matter, but what it means is taking some sort of ownership in the fact and some sort of recognition, acknowledgement, reconciliation that Black lives are not treated the same as other lives. And when people say Black Lives Matter, again, it doesn't just mean Black Lives Matter. It means what COVID-19 has showed us is that racism perpetuates itself in public health. It impacts public health when it comes to disparities, but it also impacts one of the leading causes of deaths for Black men, which is police brutality. So again, when we say Black Lives Matter, that's what people are talking about. And of course, everyone has different opinions on that statement, but that's really what it means is that racism is a public health crisis, just as COVID-19 is a public health crisis, but it's been a crisis for over 400 years and we have not dealt with it. And that's really what the meaning of truth and reconciliation means, is acknowledging that and moving forward and making amends, taking ownership.
I think what's hard, Chloe, and just to kind of add some thoughts, something that's hard is that what you're talking about is a long walk in a new direction. And we always want quick fixes and we want things that make sense and that are instant and then can affect my life right now. And this conversation, it just has to keep happening. It has to be, you know, I'm obviously a white woman and I have lots of conversations with white folks. And it's kind of like this constant awakening of, think about this, think about it from this perspective, you know, what about this and how about that? And you know, something that I always go back to is somebody asked me one time after I gave a presentation about the reason I do have done the work that I've done. And I talked about the achievement gap. And somebody afterwards asked me, why did you have to go back to race? And I just told him, look, when the numbers stop predicting that race is a risk factor, then we can stop talking about race. So there's just that increased awareness and understanding that people, I think, need to have, and beyond that, build empathy toward one another and their experiences. Even if they haven't experienced what someone else has, I can at least appreciate the fact that you have a different experience and that's just as real as my experience is. And we can walk together to build a new experience for the next generations that come after us. But it is a long, difficult walk and conversation in a completely different direction than where we've been going.
Well said, Leanne. Does anyone else have comments?
I was just going to say, I appreciate you all for putting this whole thing together the whole entire week to give space to have this conversation. I think it's a conversation that's going to have to keep on being had over and over and over again until something changes. And I do appreciate being a part of that. As a woman of color, I go into work, I live my life every day like that. When I'm serving people in the community, that's how I perceive my work, and that's how I understand the needs of those that I'm serving. So I already have that conversation with myself every day, but it's different being a part of partnerships and agency that also is allowing space for that to happen. I think it's a beautiful thing. For example, like working with Commonwealth Catholic Charities, as these things are happening in the news, our CEO is sending out emails like, hey, this happened, this is how it may be impacting us, take that space to have this conversation with your peers. They're using, we have to have a 30-minute space every Tuesday and Thursday to come together and have like a little mental health conversation. They're doing little things like that to give us space to process. They just recently formed an anti-racist committee. There's a difference in saying, hey, we're not racist, or we have these different values, but it's different to be anti-racist and try to put those policies in place. So I appreciate you all for everything you're doing, everyone on this call, the different things that you're doing, because all that radiates out into our community and to the people that we're serving day to day. So I just want to say I appreciate that.
Thank you. And I mean, to sit in a professional setting and say Black Lives Matter, like, did anyone ever imagine saying, I can speak for myself. Did anyone imagine that you could say that in a professional setting? Like that's what kind of shows how historic this moment really is. And it's refreshing to even be in this space, seeing myself represented with other people of color, especially folks in leadership roles and with allies. So, I mean, I just want to iterate to folks who are listening on Facebook that this week is not a trend. Black Lives Matter is not a trend. Of course, we know COVID-19 is a crisis, not a trend. And we just have to keep these conversations going, and they're tough, but we have to keep going to make sure that this moment is meaningful and not a discredit to the lives that have been lost because of inequity, because of police brutality, or because of racism. So thanks everyone for joining in. A couple of things for folks listening in. We're encouraging everyone to attend the Where Do We Go From Here, which will take place Friday. It's going to be Zoom only, and we will not be featuring that session live. It's exclusive to Zoom only, but it's for everyone to join in and participate in a conversation Friday at 4 p.m. on where do we go from here. And we want to decide that as a community, and we want everyone to have input on that. And then anti-racism tips was mentioned on this call, and we also have Redefining the New Normal Saturday at 1 p.m. Allies or All Lives, tips on anti-racism. So that again would be available on Facebook or Zoom. And I definitely encourage allies particularly, it's welcome to everyone, but I encourage that allies particularly attend that session. There's also tomorrow the Governor's Town Hall, August 6th at 2 p.m. And so it's the Governor's Statewide Town Hall on racial equity and police reform. And the Governor's Office has also encouraged Racial Truth and Reconciliation Week participants to attend that. So I hope we can be represented. But in closing, let's close with a dream list. If you had a dream for special session or the next General Assembly session, some action-oriented community level interventions that can be made or state policies that could shift the experiences for those that you serve, what would it be?
That's a loaded question, right?
I was gonna say, we're about to reveal some political affiliations and ideas right now that might be a bit radical. I don't know.
We have to dream right, though. We have to dream right. Okay, I will start first. One thing that I would love to occur is for TANF, the Temporary Assistance for Needy Families, for there to be an increased cash assistance for families that are struggling so they can meet their basic needs. And I'd also hope that because we have a surplus in TANF, that at the state and federal level, we could increase the benefit to families to move with the increase in increased inflation. It's not in line with the inflation that we've had in Virginia. So that's what I would hope for. Families need cash. We have EBT, we have SNAP, we have WIC, but families do need cash assistance too.
Mm-hmm. Yeah, I was kind of thinking that as well, Chloe, as far as, you know, especially because of COVID-19 and us and families needing cleaning supplies. And I think Jamaal mentioned something about toiletries and that cannot be bought with SNAP benefits. And so it was when that's all you have because you no longer qualify for TANF, and all you get is food stamps, you not being able to utilize that for essential cleaning supplies and things that everyone in normal day, you know, that we kind of take for granted that we can purchase and keep our house clean and healthy from and now it's being, we can see it now with COVID-19 that it was an area of lack because they did not have the cash, to purchase those items, and you can't purchase them with snaps. So something along the lines that you just mentioned, as well as before, I don't know if you can see my shirt, but ending homelessness is a public health crisis. So that, I think the conversation with legislative and, that needs to still be had. They acted quickly. We got this money because of COVID-19 to serve those that are homeless, to get them quickly in shelter. But it was already a health crisis before COVID-19 to have so many people on the streets with families with no shelter and no stable housing. And I am grateful for the money that we got, and we are using it to our advantage to end homelessness. But that needs to still happen. After COVID-19 is gone, we still need to be addressing the needs of those that are homeless or housing unstable. So.
I think for me, it's been interesting getting ready for this conversation. I read, of course, I kind of dug into the Alice report, and it challenged me because it was a lot of things that I knew, but looking at the numbers and then looking at the graphics that describe the amount of jobs and the deficit of pay, and the difference between the high level, high pay, innovator related jobs versus the jobs that relate to our infrastructure, and how those infrastructure jobs, many of those are the jobs that people who are in the Alice population have. And so the people who are taking them, and we know this intuitively. This is why we say teachers and educators need to get paid more, because the people who are taking care of our society are often the people who are on the brink of a financial crisis when something like this happens. So I think in order, and this is really me dreaming because I don't even think I've articulated this, but I think I would love for us to look at what does it look like to shift that, to make economic health equitable across our workforce, and create income, not necessarily income equality, but just something that allows our hardworking, dedicated citizens to be able to live, and to live safely, to live in a healthy way, and to pay for their needs. This population is going to keep growing, and the need is going to keep growing, and we're going to continue to have increased disparities if we don't take a really deep look at, I think, some of the policies and practices we have in place around these structures. So I don't think that's very specific, but I think it would be a good next step.
Does anyone else want to add on?
One thing that has been bothering me lately, with the folks that I'm serving, is we've been able to put folks in these emergency shelter situations with these funds, due to the CARES Act, et cetera, because of COVID-19. But we have these people who have limited income, typically our Social Security income. So for example, one client, their income is $783 for an entire month. That's all the money they get for an entire month. They can't work to bring in any more income, so they have that and whatever SNAP benefits. So even with having them in a sheltered space, trying to help them transition out, even with potential rent and deposit help, finding somewhere that's affordable based on that income that they've been told that they should be able to live their life with, right? I don't know if any of you all have, hopped on Zillow or apartments.com or any of that recently and put in, $600-700 for the max range, but there's not much out there for folks. This is even with clients I have who have a voucher through like the local housing authority. There's just not places that are actually affordable to move to and to live when you take that into account, their income versus expenses, rent, and things of that nature. There's just not a lot of living possibilities for folks with low income like that. So if something somewhere can be created to help folks have somewhere to move to that's actually affordable. I know affordable housing is a term that has a separate meaning. So actually affordable housing for folks, that would be so beautiful. Not sure what has to be done for that to happen.
Yeah.
Kind of chime in to kind of what Keke was talking about, and the wild thing is that, you have such a high homeless population, but as you ride around Petersburg, you see so many abandoned homes, you see so many lots, and, and this is probably wild dreaming or really off the cuff thinking, but I remember, it was a small town in North Carolina where my mom lived. There was a program that, I don't know the name of it, but they were taking dilapidated properties and, things of that nature, fixing them up, and then giving them to people who, needed subsidized homes or needed housing. Mm-hmm. So, I mean, I would love to see something like that. I mean, the population, we have such a high population of students that are staying in hotels, such a transient population that is, they go from hotel to hotel, but there's all of these buildings and all of these properties here, but maybe that's just me. Maybe that's just a weird dream, but I would love to see something like that happen. I mean, there's so many properties and houses that are just sitting there rotting away.
I'm gonna bounce off of that. Habitat for Humanity is an agency that I've heard of that does that. We used to have that in the area. Something weird happened. I know they're not doing what they used to do, but that's just one of the organizations that does that type of work. I know that just because I was in a meeting somewhere and the lady wanted to, but some local like CBDG money can be applied to do housing rehabilitation. It was a whole process, blah, blah, blah. But if folks are interested in that type of thing, there are funds out there for that. I guess you just find the people with the know-how and the ability to make that happen.
Mm-hmm. So I guess my take is going to be a bit radical. I fully believe in the call for defunding of the police, the military. I think we can definitely reallocate funds to social services that actually impact larger groups of people. One of the most disturbing things for me, I am a Petersburg resident. I live there. And when I arrived and seeing the police cars, the kinds of police cars that they had, they almost seem state of the art. They have SUVs, and when you go on the Robert Wood Johnson County rankings, Petersburg ranks 133 out of 133 counties across a multitude of indicators. And so to me, it's how did this money get allocated here? And I just think that in Morgan's ideal world, there would be an allocation of funding where people can have affordable housing and don't have to walk or go miles for healthy food access, and that schools are actually able to be well funded across the board. And they can't say we don't have the money because the money is there. It's just, where is the money going? And so I think a little bit more radically than some folks. And I just really hope that the politicians that emerge over the next decade have an inclination or desire to work for the people and not corporations. And if that can happen, I think we'll really see a shift in society and in our communities.
And Divest to Reinvest is on the Virginia Legislative Black Caucus's policy agenda as well. Encourage everyone to watch tomorrow at 4 p.m. There's a youth-led Q&A with the Virginia Legislative Black Caucus for RTRW. Morgan, could you explain to everyone what defunding the police means or what Divest to Reinvest means? Not everyone understands what the connotation of that.
Right. So it does not mean abolish the police, which I see many folks kind of touting as a reason why we shouldn't, but it just means shifting our pot of money. So we're splitting it up. And right now the pie slices are not even. We have large pie slices that are going towards surveillance of communities and purchasing of militarized equipment. And instead of funding going towards social programs and social workers and in the work that many of the folks are doing here, we have to scrape for $30,000 grants when there are $1 million being thrown around to, make sure that the military has certain equipment and actually the police is becoming more militarized. So for me, and I think for many of the folks who are supporting divesting from certain, or from the police or from the military, is that just shifting money so that we can adequately address issues that are affecting our community. I saw that police don't necessarily stop crime from happening. They will, that's social work issues. Many of the issues that we have, Leanne talked about it, and we'll probably see more because of COVID, is that you have emotional and mental instability because you have lack of housing, you have a lack of food. And so that translates into crime. And so then you need more police to, to incarcerate these individuals. And unfortunately, that doesn't solve the problem. It's a reactive way of dealing with things rather than a proactive way. And proactive is if we dedicated more funds to make sure that people are well fed and are housed and have adequate jobs that will support their communities and their families, then there's less likelihood that crime will take place. And then we don't need to have as many measures in place to incarcerate and to criminalize them. I hope that makes sense.
Right.
It's not my area of expertise, but.
Yeah, so racism in itself perpetuates a position of impoverity where families are in survival, where they have to move to participating in gangs, to petty larceny, et cetera, to survive. So if you're a young child witnessing your mother struggle to meet basic needs, food, clothing, shelter, and you have to make a decision whether your siblings starve or whether you get involved in a gang, you're going to choose getting involved in a gang because at the end of the day, you have to survive. So what divest to reinvest means is divesting police locality funding and shifting that really to prevention and to intervention. So, for example, in the case of Marcus, which many may have heard of the Marcus Alert, Marcus was in a crisis, a mental health crisis, and instead he was shot and killed instead of getting the adequate services that he needs for crisis intervention. So in that case, it could have been a social worker responding to that case, that crisis. It didn't have to be a police officer. So we're out of time now. I'll give Erica just a chance to answer this question that came up. The larger cities of America are making tiny homes for the homeless. Has this been considered in Virginia? Have you heard anything about that?
So it has been considered in Virginia. It does different. I think the problem is having investors and those that will financially support the building of tiny homes. I mean, because they're not going to make money off of it, per se. And so, it's still being talked about. It's still something that's on the table that those that are working in the homeless services keep pushing for. And hope to make it a reality because they are doing it in lots of other states, Oregon, Portland, Oregon being one of them, where they have built tiny homes for the homeless that also allows for home ownership, because then smaller homes, they cost less. You can get into, you can be able to afford, down payment and mortgage, and, we can we don't have time to get into that, but then building building generational wealth for us, brown and black people would be wonderful. But yes, so just to answer that question, other cities are doing it, other states are doing it. We have some, I think in the Fredericksburg area, an agency that is currently looking into tiny homes and building tiny homes, as well as the Housing Resource Center in Virginia Beach. It's also partnering and working with a builder around tiny homes for the homeless. It's just something that's it's not out there, but it's being talked about, and we are pushing for it.
Awesome. Well, thank you so much. Thank you everyone for participating in Virginia's first ever Racial Truth and Reconciliation Week. We definitely have a couple of more great events coming up. There's the impact of racism on maternal mortality, which will be joined by Delegate Lashri Scared and Senator Jennifer McClellan. Tomorrow, we also have the Q&A with the Virginia Legislative Black Caucus, and you definitely want to participate in the Where Do We Go From Here session. On Friday, allies are encouraged to participate in the Allies Are All Lies session on Saturday. So join the Governor's Town Hall tomorrow as well at 2 p.m. Thank you everyone for joining us. Stay tuned, and you can watch all of the other events that you may have missed at vakids.org or follow facebook.com/racialtruth. Thank you.
Thank you.
Thank you for the opportunity.
Thank you.